Good morning, everybody. In New South Wales, we had just over 14,000 tests in the last 24 hours, which is very good for a weekend, but obviously we want more people to come forward and get tested, even with the mildest of symptoms. We had 10 cases in New South Wales, although it's important to note 6 of those were in hotel quarantine, so just 4 in the community, all linked to the CBD cluster, and Dr. Chant will give a further update. But it's pleasing to know that our fears about the CBD cluster have yet not materialised, in that it's been contained, and I want to thank to this point in time, and I want to thank our health officials in particular for being so diligent, because potentially that could have seen a number of more cases. We're not out of the woods yet in relation to that cluster, but it's pleasing to know that the rates of community transmission are not as bad as what we'd first anticipated, given the potential for the virus to spread amongst people coming into the city from various different locations. I also wanted to thank the vast majority of our public for enjoying the outdoor weather but keeping a social distance. Assistant Commissioner Casa will give an update, but pleasingly police gave very positive reports about people's behaviour, about social distancing, and I think this augurs well for the future. Today is the last day of winter, and I'm pleased that we got through the winter months as well as we did. And now that the warmer weather is upon us, can I please ask everybody to think about their activities when they're out of doors? As Dr. Chant tells us, to be outdoors enjoying the sun is a healthy experience. Just make sure you keep your social distancing. Enjoy the time with your family, but if you're with friends or people outside your household, please make sure you're always maintaining your social distancing. And in the main, that was found to be the case. So to date, New South Wales is holding our own. Every day is a battle, and that's why it's really important to encourage people who have the mildest of symptoms to come forward. Normally August, September is the peak time for the flu, but obviously because we're all hand sanitising well and keeping our distance, those numbers haven't materialised. But what that means is if you do have a symptom, you should assume it's COVID, not the flu, because we know the rates of flu are negligible to very low. So if you do have the mildest of symptoms, you need to assume it's COVID, it's not the flu. And as we said last week, please don't wait till day 2 or 3 before you have a symptom. Please go the day that you feel unwell and stay home and isolate until you get the results and the advice from health. I now ask Dr. Chant to give her update. Assistant Commissioner Casa will give an update on compliance over the weekend, and then we'll take any of your questions.
So there were 10 new cases of COVID were diagnosed in the 24 hours to 8 p.m. last night, and there were 14,232 tests performed. Of the 10 new cases to 8 p.m. last night, 6 are returned travellers in hotel quarantine and 4 are locally acquired and linked to a known case or cluster. All 4 locally acquired cases are linked to the CBD cluster, and these include 2 who are household contacts of previously reported cases and 2 who are close contacts of previously reported cases. There was also 1 previous case from southeastern Sydney whose source was under investigation and had been linked to the CBD cluster, and the case was a passenger on a bus at the same time as another previously reported case and may have shared some other exposures. So that's being further investigations of that, how that transmission occurred is underway, and we have reached out using Opal card data to identify people who were travelling on that bus. Pleasingly, 10 of the 11 other passengers on that bus had their registered Opal card details, and we've made contact with 7 of them through their mobile phones and have left messages for the remainder. One passenger on that bus did not have a registered Opal card, and therefore we are still making the public aware of the bus route and the details. In terms of cases under care, we've got 66 COVID cases being treated by New South Wales Health, and including 6 in intensive care, 4 of whom are ventilated. There was also a couple of other localities that we wanted to highlight. Anyone who attended the following venues is considered a casual contact and must monitor for symptoms and get tested immediately if they develop. After testing, you must remain in isolation until a negative test result is received. And so that's the Woolworths Balmain from 10 a.m. till 11 a.m, the Chemist Warehouse at Balmain on 29 293 Darling Street, Balmain, on Friday the 28th of August from 2 to 2:30 p.m. Sushi Rio, 345 Victoria Avenue, Chatswood, Thursday the 27th of August from 5:45 p.m. to 7:30 p.m. and Coles St Ives Shopping Centre on Friday the 28th of August at 1 to 2 p.m. So just to clarify, anyone who attended those venues is considered a casual contact and must monitor for symptoms and get tested immediately if they develop. After testing, you must remain in isolation until a negative result is received, and that is essential. Also, one case worked at the Redham Early Learning Centre at Linfield for 3 days on the 25th to the 27th of August before becoming unwell in the evening of the 27th of August, and the centre has been closed while cleaning and contact tracing is underway. In terms of the updated advice for aged care, late last week on the Friday, we started to become very concerned that the CBD cluster may have led to seeding in a number of other areas. Obviously, a number of people travel into the CBD, and we knew that some of those individuals were out and about unknowingly because they were in that pre-symptomatic period, but were infectious. We've been closely monitoring cases associated with that cluster, and it's pleasing to see those case numbers are low. We're still urging anyone who has symptoms to come forward for testing, but if this reassuring picture continues, we will be updating our aged care advice later in the week ahead of Father's Day, and may well be able to ease some of those restrictions on aged care. Thank you.
Good morning, everybody. Over the weekend we saw large crowds out and about in the Sydney and regional New South Wales. We saw large crowds in parks, out and about beaches and on the snowfields. By and large, they were all enjoying the warmer weather, but certainly complying with the requirements of the health orders. No infringement notices were issued, which I'm very happy to say. We see that complacency is probably one of our biggest risks when we are looking at this pandemic, and we ask members of the community to continue to act responsibly and to comply with the health orders. Thank you.
Questions?
Dr. Tan, regarding the X39 bus and the 2 cases that were travelling on that bus, is a working theory that one case may have contracted it from another case on the bus?
That's correct. Our investigations are ongoing, but we are open to the hypothesis that the transmission event occurred on the bus. We're currently going to review CCTV footage, and hopefully that will clarify where the position of people. But we do also know that the 2 people got disembarked. It was disembarked at the same stop. So we're also looking at other crossover points in terms of the individuals.
And given that it may have transmitted, the virus may have been transmitted on the bus, do we need to look at different guidelines for people using public transport, perhaps changing the capacity on public transport or mandatory mask use?
So at that time, the Opal card data indicates that there were 14 people on the bus. And one of those was a couple that we know of. In terms of the spatial distribution, that will be gleaned from the CCTV footage, but 14 is within the bounds of not being a particularly crowded bus. We clearly have been messaging for many weeks about the importance of mask wearing, and I'd again like to call out to the community. When you're in situations such as on public transport, on your buses, trains, when you're going to supermarkets or when you're going out and about and you know that you're going to be heading into environments where social distancing is not practical or you'll be put to those proximity with people, please wear a mask. It's just one small step that we urge the community, and that will assist us in reducing the risk. In this case, the person who was infectious reported wearing a mask, but we are going to confirm that to be the case. But certainly the person who then became infected was not wearing a mask on the bus. But as I said, it's important in these circumstances that we check and recheck our facts. As I said, memory and recall can be difficult when you're looking at going back over a period of 10 days and asked what your practices were. So we do want to look at the CCTV footage. We're keen to learn any new information, but at this moment, obviously, we're considering that transmission may have occurred on the bus, but we are exploring other routes, and that's why we've asked for the CCTV footage. And I'll be able to confirm whether we've been able to access it. Just for your information, there is a loop where the CCTV footage loops over itself, and that's currently on a 10-day. So we think we've got it in time, and also Transport kindly agreed to extend that duration of holding those tapes for us for future investigations.
Doctor, is there a reason that you're not recommending to the Premier why masks shouldn't be mandatory? Because there are more calls this morning.
Look, at this moment, we are continually keep our policy advice around masks under review. What's been pleasing to see is the uptake to mask wearing in the community. Our data out of Service New South Wales indicates that following our advice to the community and strengthened advice around the importance of mask wearing, we've certainly seen increased mask wearing. I would also like to indicate to the community that masks are readily available. If you're out and about, chemist shops, a number of settings have masks available. And so some of those barriers to mask wearing, I just want to reassure the community that when I've been out and about on Sunday, I certainly did see a lot of more availability of masks for the general public.
What is the medical reason for not making it compulsory?
So the issue is that we need to work through the policy issues. We need to work with the community and take it along with us. Once we make it mandatory, it will mean that there will be no exceptions to the rule. And we need to give the time for the community to certainly embrace masks, get used to them, and to acquire them. Clearly, I'm strongly saying that mask wearing add one additional layer. It's important that they complement the already key messages, which is do not go out and about if you've got symptoms. Please stay home and get tested. Similarly, we need that good, strong hand washing, and mask wearing is something that I strongly recommend, and I recommend it for all settings, including when you cannot socially distance. And we know on certain times on public transport that is challenging. We know when you're in supermarkets or other crowded environments, and that's the time to wear masks. And I would like to see that raised across the population, not just only on public transport.
So what's the difference then between strongly recommending it and making it mandatory? Because it doesn't seem to be much difference with that just in terms of enforcement.
Well, certainly in terms of enforcement, it means that then people would no longer be able to get onto that bus if they were not wearing a mask. We just need to work through with the community to increase access to masks. We need to take the community on the journey and explain the importance of masks and why we're recommending them at this time. We clearly have seen a greater acceptance, and the data indicates that there is a growing acceptance of mask wearing. And I think I've certainly been out for probably the last 4 weeks stressing the importance of masks as a complementary action. And when we're battling COVID, we should use all of the tools we have available to us to tackle this quite insidious and stealthy virus.
You still haven't really answered the question. So what are you worried about, like a public pushback, or is there a medical reason not to make it mandatory? Because everything you've said seems to point to the fact that they were.
So they are believed to be effective, particularly if you are infectious in blocking the transmission. That's why we're encouraging people to get out and about. The issue is once there's decisions around making it mandatory, then it has consequences for people who are not wearing masks. We have to work through those issues. So our mask policy...
Legal consequences?
Well, consequences that you can't get on the bus or you can't get on the train. We need to look at the age cut-off. There'll be some members of the community that won't tolerate masks for a variety of reasons. And we need to work through those issues. So our advice around mask wearing, I think one of the lessons we've learned about in COVID is it's important that we talk openly to the community about the evidence. And I have been so pleased with the response of the community when we've given advice. And at a certain point, we have to make those decisions of when it moves from advisories. But in general, the community has responded incredibly well to advice, and that is indicated by some of the data we've seen from Service New South Wales, where the community over recent weeks has really continued to adopt mask wearing.
But Dr. Chandler, the video from Transport New South Wales seems to show across the system that only the numbers are about 30% of people, of commuters, wearing masks. Is that the number you're satisfied with?
So certainly the Service New South Wales data gives different data in terms of the general acceptability of mask wearing and people reporting mask wearing. I've asked my colleagues in Transport to provide us with data, and that will be taken into account in formulating our advice around the next steps.
What is the latest number you've got in terms of percentage? I mean, you might know, the last advice we had from Transport was it was around 30%. Is that incorrect?
The last advice we had through Service New South Wales was that mask wearing was as high as up around 60-something%. Correct. But again, we get that data updated regularly. Today, as I did a spot check on a bus I was next to, and everybody except one person had a mask on there. And that is very good compliance. But we've been saying from day one, if I was catching a bus or a train today, I would 100% be wearing a mask. You should not be catching a bus or a train if you're not wearing a mask. It doesn't get more simple than that. And we have to also put our response to the pandemic into good, comparison to what we're experiencing in the community. If you look at the rate of transmission in restaurants, in hotels, in gyms, I mean, this is potentially the first one we've had on public transport, and I say potentially because Health's still doing their advice. What we have to do during a pandemic is look at the overall picture, because when you adjust a policy mechanism, you have to do it across the board in a whole range of different areas, because you can't prevent transmission happening in a whole range of other venues where people are mixing. And that's why we say the mask is very important, but it's the fourth line of defence. And you have to consider a whole range of options, and you have to also consider where you are, what stage you're at in the pandemic. Now, the health advice is always evolving, and the advice we get from customer service and transport and other agencies is always evolving on the percentage of people who are complying. And if you recall, we said to businesses, if you don't show greater compliance and being COVID safe, we'll have to put in more restrictions. We've said to people on public transport, please demonstrate your capacity to increase compliance, and we've seen that happen. But we would not be afraid at any stage to change our advice if that was a strong recommendation from health. But what we need to do is assess the risk overall, assess people's behaviour, and even when you do make things mandatory, as we've seen, there are always people that don't comply. It's a small percentage, but it only takes a few people not to comply. So please know that if the health advice changed on that, we wouldn't hesitate to act, but you need to put it into perspective. You need to put into perspective as to which stage we're at in the pandemic, and you also need to put it into perspective in terms of the number of cases, how they're spreading. And we know the greatest risk to getting the virus is from someone you know well. It's a household contact or someone you're socialising with. We know, because of the data, that is the highest risk. The random contraction of the virus is the least risk. It is a huge risk, but it's a greater risk to get the virus from a household contact or somebody you're socialising with. And that's why our response has to be commensurate with the risk. And you have to make sure you bring the community with you. You have to make sure you assess the number of cases you have and where you're at. And our advice on masks can't be stronger. If you're going grocery shopping, if you're at a crowded supermarket, if you're on public transport, if you're somewhere where you can't guarantee social distancing, for heaven's sake, wear a mask. If you're going to a place of worship, you should be wearing a mask. If you're going anywhere where social distancing could be compromised, and not necessarily through your own actions, but through somebody else's, wear a mask. That is a strong advice. And to date, I want to thank the community who have taken the opportunity to update. And as I said, I'll get a further update on Wednesday, but the last update I had mask wearing increased substantially. And that's the trend we want to see continue. Similarly with businesses. We've seen the number of businesses who register through Service New South Wales to say they've got a COVID safe plan has also increased, because we send a warning to businesses to say, if more of you don't register, if more of you don't have a COVID safe plan, we will need to put in more restrictions. But I think, as Dr. Chant said, it's also appropriate to give the community the chance to take up the opportunities we're giving them, to take on board the advice we're giving. And if at any stage that changes, we will do that. But please also note that for every decision we take, there's always detractors. And I, as you may know, aren't going to be swayed by the detractors. I'll be swayed by the health advice and where we're at in the pandemic. And I'll also be swayed by where we think New South Wales is heading and what mitigation actions we need to take. But in summer in particular, when people are outdoors and social distancing, it's actually healthy. If you're socially distancing to get fresh air, it's much healthier to do that than to be in an indoor environment in a confined space. So we need to put things into perspective. We need to make sure people have the opportunities to take our advice. But I can't be, and Dr. Chant can't be any clearer than if you're catching public transport, if you're going shopping, if you're somewhere in a confined space where social distancing can't be guaranteed, especially at places of worship, you should be wearing a mask, and it doesn't get clearer than that.
On that premise, so that you're thinking about, at this point, it sounds like there was potential that on that bus it was transmitted, but someone was wearing a mask, so in that case it didn't stop the transmission.
Well, that's exactly the point, and that's why you need to assess the risk. We know this is an insidious virus. It can transfer from surfaces, it can transfer through other mechanisms. So therefore, every time we have a case that might have different circumstances, we can't react in a way in which it's going to change the whole strategy.
We have to. Mask wearing could be a bit simplistic.
Well, I feel it could give people, the health advice says it also could give people a false sense of security, because what we don't want is people with symptoms thinking they can wear a mask and go out and conduct their business, because that won't work. We need to make sure people appreciate as soon as you get the onset of symptoms, and that was our biggest concern last week and remains our concern, people are waiting 2 or 3 days before they get the test. Please do not wait. Please do not wait. Get tested as soon as you feel the onset of a symptom, no matter how mild it is. We have to assume it's COVID, especially if you live in southwestern and western Sydney, because we do know the virus is circulating amongst the community. And our advice can't be stronger than that. Absolutely, masks are important. Absolutely, they're critical in part of our defence to the pandemic. But all of our policy settings have to be commensurate with the risk at any given time. And we also need to consider the broader implications of anything we change, because it does have a huge impact on other parts. For example, at the moment, we've not said you have to wear a mask if you're in hospitality, but we know most venues are requiring their staff to wear a mask, which is a great sign. We haven't said to businesses, you must have a COVID safe plan, you must register formally, but most are. So these are good ways in which we've seen compliance increase. And we've also seen the results of that in that we've been able to, by and large, contain the spread of the virus. The unknown cases always worries me. I know it worries Dr. Chant. The accumulation of the unknown cases is the biggest risk, because what that tells us is that the virus is circulating. People may have accessed it from a particular venue or a particular spot which we haven't identified. That for us is the biggest risk.
Premier, in regards to borders, will your government this week change the health orders to allow the free movement of farm contract workers or agriculture workers from Victoria into New South Wales, similarly to how trade workers are allowed across state lines, in line with what John Barilaro and Adam Marshall have called for today?
Well, firstly, Minister Marshall will be joining all of his agricultural ministers tomorrow to have a national plan, and we'll be discussing this at National Cabinet on Friday. I think it's important for us to have the same rules across the nation in relation to this, and I completely appreciate the concerns of the agricultural sector, especially now that the drought has broken in many parts of New South Wales. We want to see farmers benefit from the harvest that's hopefully likely to happen in the next little while. So there's no doubt I appreciate the concerns raised, and we're trying to accommodate all of that, but I'll also be guided by the health advice. We do need to know that every time, and it's a risk you take on, but as we said, we are foreshadowing relaxation of the borders in relation to border communities and what they can do, and I'll have something to say about that later in the week, no doubt about that. But in relation to agricultural workers who are moving in and around outside of those border communities, which is what we're discussing, please let me be clear that already agricultural workers within the border communities are able to freely move around. But what we're suggesting now, what's been put to us, is can an agricultural worker not from a border community go anywhere in New South Wales to work on a farm? And that does present a bigger risk, but it's a risk that we have to assess and a risk we're willing to take on if that's what the health advice says, and we're getting advice in National Cabinet on Friday about that. I would prefer to wait till Friday to get the national advice from the AHPCC, which is Dr. Chan and all her colleagues, to put forward a national strategy. And I also feel it's important to have a national approach to this so that we're not out of kilter on what's happening in different states. And I think they're appropriate discussions to have, and I think Minister Marshall and the Deputy Premier have been entirely appropriate in raising those concerns. They are representing those communities that are concerned about having a lack of workers during this important time. But having said that, we will take on board what the Agriculture Ministers say tomorrow. We'll take on board the advice we get at National Cabinet on Friday, and New South Wales will, of course, assess the risk and take the advice we get from Dr. Chan and her colleagues.
You don't need to wait for National Cabinet though. You can just make agricultural workers an essential service like freight workers in the health board.
No, but they already are. I mean, we don't, in New South Wales, we've taken, I think, the very sensible approach of only saying what you can't do. But in relation to agricultural workers, we've already, within the border communities, they can now move very freely. What we're talking about is agricultural workers being able to go from a non-border community to any part of New South Wales. Now, that's a very different proposition and a different risk. And that's why I will absolutely be waiting till Friday to advise. Who am I to make a decision without getting the health advice? I would never do that. This has to be based on the risk. I completely empathise with our agricultural communities. I think they do have a case to put forward in terms of having workers move more freely. But we also need to make sure how we mitigate the risk of transmission into regional New South Wales. And that's why it's important to wait for the advice. It's important to also understand, and I'll be getting briefings on the situation in regional Victoria this week as well, which I've requested, to make sure I have a good understanding of the risk outside of the border communities in other parts of regional Victoria. And I commend my colleagues for defending their communities. That's absolutely what they should be doing. I look forward to hearing what the Agricultural Ministers say tomorrow, and I look forward to the advice we get on Friday from National Cabinet. But in the meantime, there will be a relaxation of the borders in other matters between New South Wales.
What do you make of Ronnie Taylor's suggestion backed by John Barilaro for school formals for school leavers in regional areas?
Can I just be clear on that point? Dr. Chan and I have said from the outset that the direction regarding milestone events like graduation ceremonies and formals only apply to term 3. Across the state, my expectation is, if we keep virus numbers low, my expectation is that all students across the state will be able to have important milestone ceremonies, and that's something we all feel very strongly about. So that would be something we'd apply to the whole state if we maintain the virus numbers where they are, and our concern remains to have as little disruption as possible for students while they're completing their exams. All we want is for students to get through the HSC with as little disruption as possible. And then in term 4, and we've said this repeatedly, Health will review the advice just as they're reviewing the advice on Father's Day and aged care. We were concerned about how far the CBD cluster would go, given to date, and I say to date because you can never rest assured, but to date, given the number of transmissions has been lower than expected, Health may very well revise their advice in relation to Father's Day and aged care. And that's why we always say the health advice is evolving. We are in a pandemic, and it's important for us to take one step at a time. But also, as we've said from day one, the health advice around school formals and milestone events only apply to term 3. And that's because we don't want to have to issue alerts where schools have closed down or exams have been disrupted. So let's minimise that risk, allow the students in what is already a stressful year to get through their exams. And I've said to everybody, my anticipation is there will be a safe way of having those milestone events in term 4.
Can we just ask quickly a question on beaches, as the popularity of them obviously grows?
Sure.
Changing. Have we got a plan yet with the councils on how we're going to manage numbers down there? Obviously it was well managed yesterday, numbers were manageable enough, people look after themselves and you have patrols down there. But when it starts to get to greater numbers, are we going to see more restrictions placed on beaches? How are we going to work that? Are you talking to councillors now and you're urging them to get plans in place?
Yeah, it's all about publicising the results of compliance and people being responsible when it comes to expectation that there's going to be warmer weather, there's going to be free time, and there's going to be milestone events such as Father's Days and the likes. It's our expectation that whatever the requirements of the health order of the day is, that people are responsible and that they're complying with it. We now have the benefit of hindsight, the pandemic having been gone through one of our warmer periods, starting in March. So we are able to reflect back on what it was like when the numbers were very high. But what we're seeing now is a stronger compliance from people out there when the weather gets better. And the weekend was a classic example in that there were lots of people. People were respecting each other's social distancing. They were mindful of the environment that we're working in, and police are out there. We're out there doing our patrols. We're going into licensed premises and in and about cafes, and no infringement notices were issued. So that's a very positive sign.
Are you disappointed that there's no, sorry, are you disappointed that, maybe one for the Premier, that councils, it was a free-for-all down there, and yes, people socially distancing, but this is going to be an ongoing issue as more people go down there, that councils haven't got their act together and put proper plans in place for beaches, especially Bondi and Coogee?
Look, there's no doubt that this will be a challenge for us as the weather continues to warm up. It's a huge challenge for us. But as Dr. Chant has said repeatedly, and she'll interrupt me if I get the advice wrong, is that it's very safe outdoors, so long as you socially distance, to actually get fresh air. That is a healthier proposition than people staying in enclosed spaces where social distancing poses a risk. And I'm also pleased to say that the New South Wales Government is working on a number of strategies to have a COVID-safe summer. We're also encouraged by the way in which our police are working with local government and keeping in close contact with local government to minimise the risk. It is a big challenge, no doubt about that. And we hope that what we saw on the weekend is repeated, where in the main people were respectful of the social distancing requirements, but were able to enjoy a healthy day out in the sun, which is what we want people to do, so long as there's good social distancing. So I can confirm the New South Wales Government is working towards some interesting, innovative solutions to providing greater COVID-safe summer. But at the same time, the police have already been engaging with local government to support them in making sure that areas such as beaches where they have jurisdiction in, they're able to provide as much social distancing requirements as possible. And I don't know if Assistant Commissioner Cassell wants to add anything to that in terms of local government and how you're working with it.
Yeah. Since the beginning of this pandemic, and whether it's bushfire season, New South Wales Police have got local committees, and they're constantly working with the local councils, local government and local other agencies to look at making sure that we've got the best possible solutions, local solutions, and any responses. So when we talk about an expected number of increased people in and about public areas, I would expect that that these local committees are working together to look at what strategies, what local action plans they can put in place in preparedness.
Premier, can I ask, paid pandemic leave, are you any closer to locking that in with the federal government?
Well, certainly we're in discussions with the federal government. At this stage, you need to declare your state a disaster to be able to receive the funding, and we are absolutely in discussions with that. We're not at a stage where we need to declare New South Wales a state of emergency or disaster, but obviously we want to mitigate against any disincentive for people to stay home. Absolutely, once you have a symptom, you need to stay home. But we don't want people to feel that that means they can't pay their bills or get food on the table. So we're looking at every opportunity to negotiate our way through that.
The school holidays are only 3 or 4 weeks away. Should parents give up any hope they may have had of taking the kids to Queensland?
Oh, look, that's a matter for the Queensland Premier, but I doubt we'll see any movement on that until at least late October. So I would not plan on having. What I would do is plan to have a COVID-safe holiday in regional New South Wales, and would encourage people to plan accordingly. And I think there's no better place than regional New South Wales for a holiday at this stage.
Because now we're into spring, people are looking towards Christmas. What are you telling the people in New South Wales? What are we doing for Christmas? Is it on? Is it off? Should we have it?
Look, I've learned that you have to take every day, every week as it comes. But every week that goes past, I'm feeling more hopeful and confident about where New South Wales is, and that's only because we had a really risky 6 or 7 weeks we've just gotten through. I'm not suggesting we're out of the woods yet, far from it. It's a daily battle, and as Dr. Chant and her team know, the work going on behind the scenes, and even Assistant Commissioner Kasser and the police force, the work that our major government agencies are doing behind the scenes is nothing short of heroic. And I just wish everybody got the insights that I get every day as to what's the effort that's been put in by thousands of people across our state, plus the community, just to keep this virus under control. It's a mammoth effort. And so we're not out of the woods, but I'm feeling much better about our capacity to be resilient, to get through a very difficult time. It's very pleasing to see the number of cases in Victoria decline, because that reduces the risk to New South Wales. In effect, we are a buffer to Queensland. Because of our close physical proximity to Victoria, New South Wales acts as a buffer to Queensland, and that's why we've seen the outbreaks from the Victorian strand here in New South Wales. It's just inevitable when you have a century of commerce and trade and social connections, that when the state, which has 55 border crossings with you, has a high number of cases, that's always a risk. And now that the number of cases has significantly declined in Victoria, our risk assessment also declines. However, it only takes one case to get out of control, and overnight we had 6 new cases in quarantine, and that is again a high-risk environment. So we have to be forever vigilant, and Christmas, I'm hoping, will be a positive time for the people of New South Wales, and I hope it'll be a time when all of us can look back on 2020 and say we survived it, and that 2021 will be bigger and better.
Premier, just quickly, it's not going to be a great Christmas for some Salvation Army workers that you've probably read. A lot of them stood off stood down in recent days. I think 15% of the workforce lost, and there's some important services impacted. Are you worried about that? And are you curious about the financials there, given government spends a lot on Salvation Army, so a lot of money raised in Red Shield, etc. Where's the money going? Is where I'm leading, and why are we seeing those cuts at such an important service?
I think generally our charitable non-government organisations do an outstanding job, and even when you're paid in one of those organisations, you're often volunteering far more hours than what you're getting recognition for. And I want to thank literally the tens of thousands of workers in various charities across the state for doing an unbelievable job. But I think through the bushfire season as well, there is an opportunity to give public confidence in openness and transparency around charities in general. It always breaks your heart when you hear people being stood off, no matter what they're employed in. We have hundreds of thousands of people in New South Wales on JobKeeper. My job and the job of my government is to make sure we transition as many people on that list to new jobs, to different jobs, and that's why we're pleased that over 100,000 people took up the opportunity to enrol in a free TAFE course. That's why we're pleased to encourage further investment, whether it's through government or industry, into tertiary learning and tertiary training, whether it's on-the-job training or whether it's through the courses we're providing. I mean, jobs have to be our focus in the next few months, and I think it's heartbreaking no matter where people work, especially young people. Normally when you're in the first few years of your career, getting your foot in the door is a critical time, and a lot of young people are missing that opportunity, and I know federal and state economists are concerned about that, as am I. But I'm feeling more optimistic about our capacity to create new jobs, to generate extra jobs in areas which previously New South Wales wasn't known for. I think it's also pleasing to know that 1,600 businesses took up our opportunity to retool or start manufacturing supplies in New South Wales, which we didn't do otherwise. Medical supplies and other things, that's been incredibly encouraging. Businesses have adapted. Some businesses have actually seen this period as a period of growth and innovation. And I'm always forever optimistic about the future, but there's no doubt we're going to go through a very difficult period in relation to jobs.
Dr. Chan, just quickly, just one, on the CBD cluster, there was some suggestion over the weekends that it might not have come from City Tattersalls. Are you any further in that investigation where the source of that?
So the source of how it got into the Sydney Tattersalls Club is unclear at this stage, but the working hypothesis, and as I think I've indicated, we always keep an open mind, is that it was introduced into the Sydney Tattersalls by an unknown source. And remember, if you recall, we had called for people to come forward for a prolonged period before that, to come forward to see if we could identify that source. And then we believe that then people have taken it back to a number of other workplaces. So we know that, for instance, there are a number of other workplaces in the CBD that were impacted. And then we've seen further transmission often within households. So that's how the cluster has grown. But pleasingly, we haven't seen any other little bushfires or brush fires get set off. But this is a time where I need everyone in the community to really come forward and get tested. If we remain with these low levels associated with the growth of the CBD cluster and not additional seeding, then, as I said, we'll be able to revise our advice to aged care facilities ahead of Father's Day.
Thank you.
Great, thank